Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine. We've been doing a series of videos to educate the patients about the lab results and what kind of things you should do before you go to the laboratory. A lot of people, especially go in the morning, they don't have time to prepare, but it has a huge impact on it. If some of those lab values come back to normal, you're going to be worried, right? Like, what's going on? Why should I? Like, a lot of people's kind of, so it's important to make sure we prepare enough well. So it's important to educate the patients and the public. Hey, these are the things you need to do before you go to the laboratory. Okay. So the first thing, always get a slip from the doctor, the test you needed, and then let's look at like what I mean. Today we're going to talk about the sodium level. Let's say your doctor ordered the sodium level. So what are the things we should be doing when before you go to the lab? It has an impact on the sodium level. Okay, so we're going to go through a series of questions. The first one, can I drink plenty of water and then go there to get the lab results? Please do not do that. If you overhydrate, okay, what's going to happen is your sodium level can be affected. Usually it becomes dilutional and your sodium level go down. So don't do that, okay? Let's say if you get dehydrated, right? If you drink less water, it's also become dehydration. There's something called hypovolemic hyponatremia. It can also affect it. So make sure, like, whatever you do, usually do that. Don't drink too much water. Don't drink too less water either. Okay, very, very important. The next question is like, do you fast before this test, right? Let's say if you fast, I don't usually recommend for this test when you fast. What's going to happen when you fast? Usually people do waterless fasting, and then you can get dehydrated. That could have an effect. Okay. Now the next, let's say you have nausea, vomiting day before, and the diarrhea has been going on. Please don't go to the lab. It can affect it. Usually the sodium come back to low. Okay, so next question, can I go to the laboratory if I'm doing like extreme exercise day before or before the lab? Let's say if you're the person, usually a lot of people get 5 o'clock in the morning and they do this heavy military workout, right? And then go and then finish that, take a shower, and then you go to the lab and get the lab. Please don't do that, because when you do exercise a lot, you start sweating and you can lose like a lot of sodium. It has like an impact on it. Okay, be careful about that. So don't just be normal and get the lab done, and then you can do the exercise. Okay, I know some people go to the sauna and the body get like so much sweating that can affect your sodium. Okay, don't do any of that before you go to the store. Next thing, can any medications I'm taking now have an impact? Unfortunately, a lot of medicine you're taking has an impact on the sodium, especially if you have blood pressure medicine like thiazide diuretic or any loop diuretic we call it. Usually the common Lasix and thiazide, you can decrease your sodium level, okay? And if you take the other common, if you have like depression, a lot of psychiatric medication can sodium level become hyponatremia core, which is like less sodium and all that too. You can stimulate this hormone called ADH, and then water retention become, and then hyponatremia is very, very common. And the other drug you need to know about, desmopressin. Okay, and then lithium, people take that for depression, can inhibit ADH, that can affect mannitol. Usually people don't take that much, but it can affect. And then let's say, if you're in the hospital and they give like a lot of IV fluids, it can affect you, but hopefully you don't have to go to the hospital. And then if you're a steroid, it can affect your sodium level also. But be careful. I'm not advocating you should stop this medicine, right? You should check with the doctor, and when you get the lab, and just have a discussion with them. When I took, it has an impact or something like that. But it doesn't usually cause the extreme, especially if you're on antipsychotic medication. That can definitely sometimes bring it very, very low. Okay? So again, every lab is kind of important. A lot of times what I see is the doctors are so busy and they don't have the time to explain to you what kind of things you should do before you go to the lab, right? Have you ever seen a doctor kind of give you a slip, go get the lab? And a lot of doctors I've seen that doing, because they don't have the time to tell you, okay, and these are the things you should do before you go to the lab. And then you get this lab results back, usually everybody, and then you say like, oh my God, my sodium is like 2 point below. What should I do? What should I do? What should I do? Okay, don't get into this situation. Make sure everything is okay. And the whole purpose is educating the public about it. And don't, if you're on medicine, don't stop it because I told you to do so. Always check with the doctor. Doctor knows best like what's going on before anything you do. It's very, very important, okay? If you like this presentation, please help us subscribe and share the video with the others so we can continue to make educational videos. So your time is valuable. You have to you hate going to the lab anyway, get stuck. Do you want to get stuck again? Or do you want some kind of lab and then come back another headache? Oh my God, my sodium is 2 point below. What should I do? What should I do? Okay? So listen to our advice. And if you have any other thoughts, please put it under comments so we can have a discussion. God bless. We'll talk later.